Good morning, everyone, and welcome to the virtual convening series, Meeting the Moment, Opportunities for Comprehensive Healthy Housing and Health Equity During COVID-19. My name is Sarah DeGia. I'm the CEO of ChangeLab Solutions, a national organization that advances equitable laws and policies to achieve better health for all. We're a multidisciplinary organization with lawyers, planners, analysts, and advocates that work with state and local governments, community organizations, and anchor institutions to create thriving communities. We do this through research and analysis, capacity building, and technical assistance to create practical policy tools to advance health equity. This morning, after my introduction and welcome, my colleague Greg will be sharing some logistics with you just to help you orient to the day. And I want to take a moment to thank the ChangeLab staff members who are helping to put this event together, including Greg, Tina Yuen, Lex Carlson, and Dan Fons. Thank you to all of you for being here at this critical moment in time. Today's convening, Advancing Healthy and Affordable Housing and Promoting Equity in a COVID-19 Era, includes we're joined by housing and health advocates, local governments, public health practitioners, people from healthcare systems, and others through this virtual convening. This type of convening across different sectors isn't a new concept for ChangeLab. Collaborating is in our DNA. While we are rooted in public health, our interdisciplinary approach enables us to understand how health outcomes are impacted by many factors and systems operating at the same time, but which often and unfortunately do not operate to promote health equity. So today we're coming together in a transformational moment as a nation. We're experiencing a confluence of many factors and events that require new ways of thinking and approaching our problems. Some of these problems include recent things like the COVID-19 pandemic, but some of the problems are rooted in the legacies of discriminatory laws and policies like slavery, Jim Crow, and even white supremacy. If we're to face current challenges and those yet to come, we will need to work together differently to address longstanding inequities for both immediate and future needs. As we've all seen, COVID-19 has exacerbated longstanding disparities and inequities. Communities of color, particularly Black and Latinx communities, are experiencing disproportionately high rates of death. But even long before the pandemic, our nation was facing a housing crisis, with communities large and small across the country struggling to find resources for quality, affordable housing, fighting to keep families in their homes, and even working to protect our health within our homes. As a result of the pandemic and economic recession, these same communities, immigrants, low-income families, LGBT communities, and others, are now facing increased economic, educational, and social obstacles. And while the data is not complete, we know that it's these families and communities who are already experiencing disproportionate health outcomes who have been ravaged by COVID-19. In addition to the pandemic, our country has experienced one of the largest civil uprisings since probably the Civil Rights Movement, protesting and speaking out against the murders of Black men and women across the country. These poignant moments in our time have more than raised awareness. They have made visible and unquestionable the existence of structural racism and discrimination. And they've shown the effects of persistent and sanctioned unequitable distribution of money, resources, and power. These moments are illustrating the roles that our systems have on our lives: healthcare, public health, housing, public infrastructure. And in particular, they demonstrate how laws and policies are intertwined with our lives and our health because they affect our choices or lack thereof. Laws and policies can reinforce health inequities by institutionalizing bias, making resources scarce, or creating unhealthy environments. But laws and policies, which we fundamentally believe at ChangeLab Solutions, can also help to, if we're using the tools of law and policy, they can help to undo fundamental drivers of inequity as well. We're hosting this virtual housing convening series to harness the collective commitment to redress the harms of structural racism and discrimination. Today's session is designed to share ideas and experiences across sectors and institutions with community advocates, legal experts, and government staff who are all working at the nexus of these issues. We hope to inspire new ways of responding to COVID-19, the economic recession, and our housing crisis, with a focus on addressing the fundamental drivers of inequities. So again, I thank you for being here during this imperative time, and we're looking forward to getting the conversation started. Greg, let me turn it over to you to talk about some of the logistics for today.
Thank you, Sarah, and welcome everyone. Before we go any further, just a couple of housekeeping notes. First, today we're using the Global Meet platform for this virtual session. For those of you who may be unfamiliar with it, you'll find a questions and answers box on the left-hand side of your screen. If you're having any technical difficulties during the session, please send a question through this box and we'll try to help you out. Second, we'll be reserving time at the end of this virtual session for facilitating Q&A. Throughout the webinar, you can submit questions for presenters in the Q&A box. If your question is for a specific presenter, please remember to identify them in your question. And third, the webinar will be recorded and sent out to all webinar registrants. And quickly, I'd like to welcome all of our speakers today. Sarah will introduce each of the speakers individually later, but we're really excited to have you all here with us. Just a quick amendment to the speaker order. Dean Matthew will be joining us a little bit later on and will now be speaking after we hear from the folks over at Environmental Health Watch in the city of Cleveland. So with that out of the way, I would just like to take a quick minute to set the stage for our presenters. Decades of research have shown that safe, stable, affordable housing sets the foundation for health. Housing located near good schools, high-quality jobs, healthy food, safe parks, and dependable transportation is essential for communities to prosper and thrive. However, our housing policies historically have not been guided by a vision of healthy and equitable communities. There's an adage in public health that your zip code is a better predictor of health than your genetic code. And it holds largely true because of the policies that have perpetuated neighborhood segregation and created concentrated pockets of disinvestment and wealth. For example, a study by the Kirwan Institute found that people who lived in formerly red-lined areas of Cleveland had higher rates of exposure to lead and toxic waste, infant mortality rates 5 to 6 times higher than those in non-red-lined areas, and a 15-year reduction in life expectancy. So why is this the case? Well, much as quality housing is important to positive health outcomes, poor housing quality is connected to, and poor housing quality and housing instability lead to negative health outcomes. Today, most Americans spend 90% of their time indoors, and nearly 70% of this time is spent in the home. But poorly designed homes and unsafe structures compromise the health and safety of all people. Poor housing conditions are associated with chronic and infectious illness, injury, poor nutrition, poor mental health, and brain development. And as of 2017, 39 million housing units contained at least one health hazard, with 5.9 million housing units containing multiple severe health hazards. Not only do these poor housing conditions negatively impact our health, they also contribute to household income insecurity and housing instability, which is experienced through being behind on rent, frequent moves, and homelessness. And these too have negative health impacts. Research shows that housing instability negatively impacts caregiver and child physical and mental health and reduces household access to key health-promoting opportunities. Further, children experiencing housing instability demonstrate worse academic and social outcomes than their peers, including lower vocabulary skills, grade retention, increased high school dropout rates, and lower adult educational attainment. But the impacts of poor housing and housing instability aren't being felt the same way across our society. We're living today in a world with persistent place-based and race-based health disparities that are the direct result of our past racist housing policies. For example, this is a 1930s redlining map of Oakland. For those of you who are unfamiliar with redlining, in the 30s, it was created by the Homeowners Loan Corporation, a precursor to HUD, which created residential safety maps depicting areas deemed safe to issue low-interest, long-term loans to new homeowners. Neighborhoods were classified into one of 4 categories based on favorable and detrimental influences. Factors included terrain and type and age of buildings, as well as the threat of infiltration of foreign-born, Negro, or lower-grade population. A areas in green were considered hotspots. B areas in blue were deemed not as desirable, but still good. C areas in yellow were considered in decline. And finally, D areas in red were considered to be in full decline, areas lenders should steer clear of. Not surprisingly, this classification method was heavily influenced by neighborhoods' racial and economic demographics. Private banks quickly adopted the government's identification system, commonly denying home loans to residents in neighborhoods considered risky. The color coding of maps became a verb. To redline a community was marked as undesirable and not worthy of investment. Although officially prohibited by the Fair Housing Act of 1968, the practice of neighborhood delineation based on race and class, along with other racist housing policies, such as restrictive covenants, lightened appraisal guidelines, predatory loans, and exclusionary zoning, have systemically excluded whole swaths of our population from accumulating wealth through property ownership. And the impacts of the racist history of our housing policy are vast. By systemically discriminating against Black and brown people, we've created a world in which we have forced people to live in concentrated pockets of poverty, leading to significant disparities in employment, education, and access to health care. And the intergenerational impacts of this have created a world in which we're seeing incredible disparities in income distribution and wealth distribution, where Black families typically have 10 cents for every dollar of wealth held by white families. And the impact of this legacy of racist housing policies will continue until we intentionally dismantle and fix the system that has created them. The purposeful and continual hollowing out of Black communities has negatively impacted the health of Black and brown communities and increased the likelihood of that Black and brown communities will contract COVID-19 and prevented access to care that they need due to the experience of housing instability. For example, Black and brown communities are less likely to carry health insurance than non-Hispanic whites. Black and brown communities experience elevated levels of chronic health conditions such as hypertension, cardiac disease, diabetes, and obesity. And Black and brown communities are more likely to report experiencing serious psychological distress, including depression and anxiety, but are less likely to be able to access mental health services and medical prescriptions. So COVID-19 has necessitated an immediate and urgent response across all level governments to address the housing needs of our community. But the impacts, as Sarah mentioned, of COVID aren't being felt equitably across our communities due to our history of racist housing policies. Even though we all come from different spaces, professions, and perspectives, we're all here because we recognize the challenges we're facing and the role of structural racism and discrimination in our current health crisis. So we're here today during this time of a new and expanded collective awareness of the consequences of structural racism to think about and discuss what we think are new and different windows of political opportunity, particularly for local housing responses and solutions that promote racial and economic equity, prevent the furthering of health inequities, avoid displacement, and ensure affordable and quality housing for the most vulnerable tenants. With that, I'd like to turn it over to Sarah to introduce our next speaker.
Thank you so much, Greg, for really setting the stage with those important connections and, again, lifting up the impact that policy decisions we've made decades ago and how they're still being felt by communities today. I'd like to now introduce Mark Willis, who's going to be giving us a presentation. Mark is the Senior Policy Fellow at New York University's Furman Center for Real Estate and Urban Policy. Prior, Mark was a visiting scholar at the Ford Foundation, following a 19-year career at J.P. Morgan Chase, developing and overseeing programs and products to help strengthen low and moderate income communities. Thank you, Mark, for joining us.
Thank you, Sarah. So I want to thank you and Change Lab for inviting me to be part of this very important webinar. As we just heard so clearly laid out, COVID-19, the pandemic, has had a disproportionately large economic and health effect on Black and Hispanic households. It has also exposed the detrimental effects of the racial and economic long-standing disparities in the housing market and across communities and neighborhoods within our cities. Pre-pandemic, we already had major gaps in home ownership for people of color, higher housing costs, burdens, and so therefore less resources for food, clothing, health, etc. Lower housing quality, overcrowding, poorer access to jobs, concentration of poverty, neighborhoods that were less well served by government services and infrastructure, and less quality and quantity of retail services. The brighter side, if there is one, of the pandemic is that it has also driven local governments to step up to meet the challenge with creative and innovative ways to deal with the immediate problems. And has helped to show them the way for them to be more proactive in dealing with longer-term structural inequities. Unfortunately here, the federal government support here has been relatively weak and incomplete. It has not helped us deal at all with the racial impacts of the pandemic, but it has provided very strong income support, which allowed many households to pay their rent, mortgages, and that has helped to minimize at least the adverse effects on the residential property market, the owners, the lenders, and the secondary market for mortgage-backed securities, all of which are important to the housing industry. So what we have seen so far was the unemployment insurance with the supplements, but those have now run out, and the future there is uncertain. But clearly that helped. But on the housing and community development side, there was only limited support from the very beginning. We've seen some efforts to kick the can down the road, as many of us say, where mortgages by Fannie, Freddie, and Ginnie Mae and Ginnie Mae being FHA mortgages and VA mortgages. They have allowed mortgage forbearance, and we've seen eviction moratoria for renters. Most recently, the CDC has also imposed an eviction moratorium to, I think, the end of December. So while these have been very helpful, these kinds of federal policies have merely, as I said, kicked the can down the road. It has not alleviated the need for rental payments and mortgage payments once these moratoriums have, all the forbearance has ended. As for actual funding for housing programs, the amount of money in the CARES Act was relatively limited, and in many cases, much of that money does not seem to have trickled down to smaller cities in particular. But most relevant for our discussions here on housing policy is that none of the federal aid was designed to directly address the underlying systemic issues that's causing the disparate housing outcomes from the pandemic. So what have cities done? Because of the limited federal action, cities have been called upon to take action. To fully respond, cities need a two-pronged approach to address their overall housing needs, and in particular to promote equity. The first prong is to address the immediate impacts from the pandemic, which include issues with homeless, housing instability, small landlords, the impact on them, and therefore on housing quality, and impact on the need for local social services and the not-for-profits that provide those. When dealing with these challenges, cities can and should be careful to craft their programs and policies to minimize creating more inequity. So I'm going to talk a little bit more about those in a second, but let me just point out also as an introduction to these two prongs, that the second prong is to face the long-term issues. Cities need to address the underlying structural inequities that exist in their communities, many of which have been laid out by Greg and Sarah, through a longer-term, comprehensive and balanced local housing strategy. So let's first start as a first prong in addressing the pandemic impacts. While cities are being called upon to address the dual challenges of the disparate health and housing outcomes that we're talking about here, they have very limited budget capacity. As we know, the pandemic and the health needs have increased the cost to local government. Many of them are facing falling revenue and cutbacks in state aid. Also, key to remember here is that localities are required to balance their budgets. So if revenues fall, their expenses have to fall. A key byproduct of this is limited staffing capacity, something that smaller cities probably have to begin with, but a number of cities have had to reduce their employment staff. And many cities have limited experience with the kinds of tools that need to be used here. So they rely on outside consultants, trade associations. We'll talk a little bit about ways to face and deal creatively with these problems. So cities have learned to be creative and innovative. So they have developed new and innovative programs and policies to address the range of these problems that I discussed, I mentioned before. So in the area of homelessness, providing uncrowded shelter for the homeless has become a very important priority of local governments. They have found new facilities to use, or existing facilities, I should put to new purposes, hotels, convention centers. To the extent that they haven't been able to bring people inside for shelter, they have provided public sanitation stations for those who are still outside. In some cases, government has also provided tents. With regard to housing instability, which, as was noted earlier, the inability to pay rent and utilities and mortgages creates housing instability, which has all sorts of other health and education and employment ramifications. Local governments have provided rental assistance, utility moratoria, and they've tried to provide relief to homeowners and to owners of apartment buildings by waiving property tax fees. All of this, though, is obviously limited by the amount of resources that are available. So also, for housing instability, we should note that you also want to try and keep people in their homes in general. So homeless prevention programs have been really important local tools. We've also, as I mentioned, some landlords are finding themselves unable to maintain their properties, to fix them up, and government can help by providing them with financial assistance, both for operating support and also to actually fix the problem, replace systems, or do whatever repairs are required. An innovative program here is one I just happened to mention in New York, which actually provides operating support, something called New York Forward. Again, limited in terms of the amount of resources that they have, but very helpful to the landlords they can serve. Last is, and certainly not least, is supporting community-based organizations. I'm going to talk a little bit more about how important they are, but they provide legal assistance for helping people stay in the home, dealing with the moratoria, making sure they apply for foreclosure, forbearance that they can get, and generally helping them with their budget needs. All of these programs, though, that localities are doing need to be done with the perspective of a focus on equity. Here I've outlined there are at least three ways to do this, and let me take us through those. The first one is about communications and outreach. Many local programs, many localities, I should say, found that initially they had a lot of trouble reaching certain parts of their community, particularly those that were most in need. And that could be language barriers or just the tools of communication they're using are not ones that are read or heard extensively in the communities they want to serve. So very important here, communication and outreach. Next is targeting and selection criteria, particularly since resources are limited. You really want to focus on those who are most in need, whether that's lower incomes or otherwise populations that are disproportionately affected by the pandemic. If the need looks like it's going to exceed the available resources, you want to think carefully about the selection criteria and what priorities you should set. One thing I can suggest has not worked well and that you really want to be careful not to fall back on is a system of first come, first serve. The ones that are most knowledgeable and maybe the least in need are probably the ones that will figure out how to apply first. So, and you also want to keep slimming down the application process to make it as easy and uncomplicated as you can. Critical to even making these first two work are really partnering with community-based organizations. They can really help a lot with outreach and communication. They also can be providers of services. So you may very well want to work with community groups to not just get the message out, but maybe they're actually going to be the vehicle used for providing assistance. And some localities have worked with the community groups to design the programs and then give them the parameters of who's to be helped and how they're going to help them to make sure to be actually the ones that work in the community to provide the services, provide the financing. The second prong that I mentioned is equally important, and I think was clearly brought out in the earlier discussion here, is that there are long-term existing factors that are perpetuating racial inequities in our cities, and for that, you really need to develop a local housing strategy that deals with the range of issues that you have. Trying to do something that just deals with homeless or just deals with one aspect of the problem is unlikely to solve it if people are becoming more homeless because, for example, there's a shortage of housing. So just providing help to those who are homeless is not ending the chain that will result in more homeless as time goes on. So what we have done here, there's a little bit of a shameless advertising for it, but something that I think can be very helpful to you is we've created a website called localhousingsolutions.org. And that website can help you develop a comprehensive local housing strategy, something that can be helpful for local stakeholders of all kinds to work with the local government to create this a comprehensive strategy. The website, localhousingsolutions.org, provides a roadmap to develop and execute local policies. It gives you a menu of over 80 programs and policies to choose from, and it is organized under 4 pillars, all of which are important. And let me just talk a little bit about these 4 pillars to think about that you need your policy to cover them comprehensively. The 4 pillars are: you need to create and preserve dedicated affordable housing units. All communities, whether they are suffering from high costs and a shortage of housing, or they are areas where there has been disinvestment, has a problem that there is inadequate supply of affordable housing for supply of housing that is affordable to the people in their community. The second one is of the 4 pillars is to align housing supply with market and neighborhood housing conditions. And here we're really talking about if you're a community there that's not building enough housing, you've got to build more housing, because if you don't build more housing, then people that have more income are going to drive up the rents of the more affordable housing. So you need to increase the supply, where in other communities there is an excess of housing that needs to be demolished in order to bring the housing market into a line with the local demand. The third is to help households access and afford private market homes, and I might add in here, and reduce the concentrations of poverty. So you want people to be able to move and live in all communities across the city. And the last is to protect against displacement and poor housing conditions, to make sure that people who are housed can stay in that housing, and that housing can provide sufficient quality. So all of these aspects need to be dealt with in a local housing strategy, all four of those pillars. I also want to mention there are the keys to success in developing local housing policies. You want to have clear program goals and policy objectives. You want to set clear milestones, and you need to monitor progress, making sure you are making progress. As you monitor, make sure you improve as you learn more about how you're doing and what's working and what's not. Here again, I'm mentioning the importance of partnering with community-based organizations. You want to work with the community and provide regular updates. Transparency is very important for continuing to build and retain public support for the initiatives you have. And the last one is very important, and we're very lucky here that the next speaker is going to be talking about what's happening speakers are going to talk about what's happening in Cleveland. The opportunity is to learn from each other, and you can learn from what other cities are doing. You can learn through trade associations, regional organizations. For those who are trying to figure out what you can do in your community, really helpful that you can learn from the successes and really the mistakes and the learnings in other communities. So with that, let me turn it over to the next speaker.
Mark, thank you so much for sharing these important short and long-term housing responses. There are some great suggestions in there, and including the comprehensive strategy that you talked about and engaging communities. We're really looking forward to digging in more during the question and answer session, so thank you. I'm now excited to introduce our next two speakers, and Mark did a brilliant job of setting them up, or setting me up to introduce them. Our next two speakers are going to be sharing some experiences and examples from the local level, the City of Cleveland. So we're joined by Ayanna Blue Donald, who is the Director of Building and Housing for the City of Cleveland. She's committed to ensuring that all structures in the city are healthy and safe for the community. And we're also joined by Kim Foreman, who's the Executive Director of Environmental Health Watch. She focuses on environmental justice issues and adverse outcomes of environmental exposures, both indoors and outdoors, that disproportionately affect poor and minority communities. Ayanna and Kim, I'm so happy to have you join us.
Thank you. Thank you for that introduction, and I'm really happy to be here today. And it's an exciting time of transition and opportunities. And for us, we want to focus on telling our story from 2015 to 2020, and we'll start to dig into the process and these outcomes and what we're launching now in the City of Cleveland together. So for Environmental Health Watch, we've been around for 40 years, and I've been there 20 years, but I became a director in 2015. And so we work on healthy homes, which is our core. We also work on sustainable communities, and we talked a lot leading up to now about a framing of equity, justice. So we do approach everything with an environmental justice and health equity frame. So in our other side of the work, our sustainable communities is really about listening to community, listening to how they define sustainability, supporting them, right, and then moving towards equitable solutions and approaches. So what's unique about us is that we're able to work directly in impacted communities with folks in their homes. We provide research and we apply that research. We also sit at decision-making tables. And a lot of that work, the direct service components, even within our research projects, informs our policy approach, right? So we hear from folks. We try to understand how they're being impacted and then how we can work on solutions with them as partners in regards to this engagement strategy. And we're always trying to be innovative, right? So equity now we're trying to learn the application of this equity concept and what's going to work, evaluate that, and come back to the drawing board and continue to evolve our approaches and our strategies. So because we have a long history, and I'm actually a licensed lead risk assessor, I've been a contractor, meaning I've written specs for contractors. I've worked directly with the health department. And so we have this technical piece to our work, which helps to inform others and train others. And so this is our history as an organization, and we're constantly evolving. This is just a list of a lot of the research projects we've done that helped inform our approach now, as well as looking at moderate and low-cost intervention strategies that get us to safer housing, removing hazards. So our approach is really to understand that we have a lot of low-income tenants, low-income landlords, low-income homeowners, and we need to find approaches that work and give folks options. And so all this work that we've done, and I've been a part of a lot of these projects, has really based and grounded us in the technical aspects of the work. And we are a small nonprofit, but we have a lot of capacity, meaning that we build teams, we work with multi-sector teams, and so we've been able to really engage long-term partners like the universities, the hospital systems, other nonprofits, government, right, and work together so that we can start to make greater impact. So this is just our approach, our equity approach about how we want to promote these regenerative environments. It's very important to understand how we partner with folks with the lived experience, and I'll talk a little bit about how we do that, right, how we're trying to do that. No one has a silver bullet. It's about your willingness to continue to change and evolve, listen, and then apply what you hear and support. So now we're going to talk a little bit about our policy approach and our advocacy efforts. And so at the time when I became a director, I feel like I had a wonderful experience to be able to build in, my leadership approach and understand who I was as a leader. But all of this attention, right, was being paid to Flint, Michigan, to Cleveland through the Toxic Neglect Led series. Information that was coming out. Al Jazeera came to Cleveland. The New York Times came to Cleveland. I was interviewed multiple times, and this really took us and took the community to another level of the conversation because the articles didn't stop. The digging didn't stop. The conversation didn't stop through the plain dealer. And at the same time, I started to implement what I'm going to talk about, the Build Health Project. So it was kind of an alignment going on. The attention was there. And so we all kind of pulled together to respond to the questions that were being asked. And we also, at the same time, had an opportunity with Build Health to address. So I'll let Ayana chime in here and talk about her experience with this time and place in Cleveland.
Good afternoon. Yes, it was, very eye-opening in the sense that there was all of this media attention because coming from the public perspective or being a director of a public department, you're always a little bit afraid of any type of news outlet doing a story about what you are not working on. But quite frankly, this quote-unquote expose or news series really pushed a partnership to forge with EHW, other nonprofit entities, other private entities, and then throughout actually internally, like breaking down the silos within City Hall to work towards an equitable solution to remediate lead in our homes here in Cleveland. It was really transformative. As much as it hurt going through the process, but it really was transformative to shed that light into such a big issue that really we have been working on with not a lot of traction for years upon years.
Thank you. I love Ayanna. She's been great. So with the Bill Health Challenge, right, it was interesting because this approach, there was a pool of funders, not just one, but a pool of funders who made the decision to make a nonprofit lead the work. I had to work with a health department, and I had to work with a hospital system in order to qualify to even apply for this grant. And I think just that shift in who's leading is very important in regards to understanding what capacity really looks like. I don't think that I think that sometimes people look at the size of the entity, or because it's an institution that they had a capacity to lead work. And I think that through this opportunity, it really showed the country how nonprofits lead. And so because we had this long history around healthy homes, right, we were able to promote our approach through this opportunity. And like I said, we're going to talk a little about our lead policy in Cleveland, but we evolved from just talking about lead as a nation to healthy homes, but the opportunity is now. And so we do see the focus on lead as a way to build systems change and then expand back into a healthy homes approach in some way. So with the Bill Health Challenge, BILL stands for Bold, Upstream, Integrated, Local, and Data-Driven. So with this, now we have around 1 and 2. So we were able to capture this work and work together for 4 years. And I must say that prior to 2015, I had been involved in a lot of initiatives in the city, working with partners. So let's be clear, we still want to respect all the work that was put in up until this point. But this opportunity catapulted us, to move into a more impactful way that we want to address housing in Cleveland and across the nation. And so we were lucky because the team we built, we were able to be highlighted as one of the key cities in this national initiative. So on the left side, our approach was to kind of look at healthy home zones in a community that was primarily Latino. But we thought that we would have to demonstrate the approach to address healthy homes and then move into this policy process. But what happened is because of the articles and the attention, we actually shifted that approach. So actually going into homes and addressing the hazards, we did that. But literally that was the priority, then became a policy approach and pushing our agenda forward. So on the left side, you see that I did note that we only needed 3 partners to do this work, technically. But we understand implementation. We understand the power of a team that could help us deepen the work and also execute. So then we added partners like the Hispanic Alliance, the CDC that was housed in that neighborhood that we were focused on, right? And we added the building and housing at that time. And luckily, Ayanna could play a role because we always had some issues working directly with building and housing in the past. And so Ayanna jumped in and really, really made a big difference here. And so a Spanish American committee as well, 2 nonprofits in the neighborhood that we were going to because we had a language barrier. We had 60% of residents, I think, didn't speak English, right? And then there's a cultural difference. We also included our Place Matters team chair. I'm a part of the Place Matters team, which is now Centers for Achieving Equity, but we also included a local evaluator. I do a lot of work on national projects, but I think it's very important to understand what's going on the ground, and we really want to understand the process, internal process. It's not just about the outcomes, but it's also about how the team works together. How are we building equity internally as well as the outcomes, and are they equitable outcomes? And so we do have a case study, which I provided to Change Lab, that tells the story of Build 1.0. And then in 2.0, we were lucky enough to get another grant, and we expanded the team again because now we wanted to build an app, and we'll talk a little bit about that in a few slides, but we needed to get to the heart of the matter, right? We want to make sure we can execute. What was important about our approach is we really want to understand through building the housing and the health department how their systems work, right? It's not just about talking about an idea or trying to put something forth without really understanding on the back end how it could be sustainable, respecting what they need to do at the government, what they need to do in their department so that we could come up with something that was practical. We are definitely about practical solutions and practical applications. And so this is just a graphic to talk about the model and how kind of these initiatives are applied through our networks and building the networks. And it really caused a buzz in the community, and we were able to continue to grow our networks. Even the city of Cleveland grew some more networks. We leveraged Build. As each team member, each organization could leverage Build as they saw fit. And I think that we created a great relationships, new relationships, as well as continue to partner today. And so we did provide money to the city of Cleveland to expand the database, which would include public health information. That was important as a first step, is to understand, like I said, internally what was needed, and then we provided resources to make it happen. We had many conversations before we even applied to the grant to understand what people's roles would be, and then we could create a vision together to implement. So that was important, providing those resources to see it happen. We were part of a lot of discussions with City Council about our 5-point lead elimination plan. That's very important as it relates to the policy we have now and what we put forth. We were able to push for the enforcement of the rental registry that was in place and a proactive inspection program. So those are the policy items that we wanted to see happen through this work. And so you... Yeah.
Just add, and I think that, it's very important to note, and going back to the leveraging and networking and et cetera, and thank Kim just for the thought of mentioning, sometimes when leadership does change, it does give you a fresh look or a new opportunity to engage or leverage a relationship that you thought, maybe wasn't going the places that you wanted it to. And quite frankly, this work that started back in 2015 and kept just progressing, we've continued to build on this the past 5 years. As we continue to go through the presentation, just keep that in mind as well, as it's really been just building blocks, one on top of the other. We started with one thing, Build Health 1.0, and now we're at another level, which is just really huge and going to be transformative to our community here in Cleveland. And just also the importance of community building. Sometimes city departments, government is viewed in a certain way. It was very important, and it still is very important for when we look through our equity lens and making sure that we're putting everybody on an even playing field, that we have community ambassadors, which EHW and Kim Foreman and her team really helps us work with. The conversations that are had with the community ambassadors and other organizations are completely different than what they have with us as an enforcement body, an arm as a city government. So I don't want to minimize the importance of that, of how much it also means to us from our perspective to advance our goals and priority for equitable housing solutions.
Thank you, Ayana. And it's important, too, that when we work with residents, right, I talk a little bit about my approach with the resident leaders is to have them break down what happens at the city level. A lot of times residents just say the city and it's just this big monstrous thing of bureaucracy, but I try to also talk about the people and places and the decision makers and who they are, what their role is, so then we can have a real relationship with folks who help make decisions. So with the case study report, this is just a learning of understanding of who's at the lead, how we working with leadership. And just to say, through this approach, 4 years, residents have issues and concerns, right? They're at the table with the entire team, and so we need to understand how we can also show concern and support them even through a planning or even while we're implementing a program. It is more important to build a relationship and also try to support them when we can, even if we have to break for a minute, address a concern, an issue, and then come back together. So this is just a quick slide to show. On the left is our product. It's an app. It's called Housing.Health. We went to the community. We asked them what data was important to them to have in this type of app. We included the university partners, the Poverty Center, who receives data from the city on a regular basis. So that's how we built the platform. And so now residents have a little more power. They can type in an address, find out what violations are in the home, find out if the house is registered. Now they'll be able to find out if a landlord has a lead safe certificate, and then we'll continue to build and add on the data. But we do have a key partner at the university who's helping to manage this, as well as Global Health Metrics, who behind the scenes built the platform and maintains and manages the platform. And part of the storytelling, which I'm working better at doing, we were invited by the Beaumont to talk a little bit about our approach as a community-based nonprofit and how we impact public health. So we do have a chapter in a new practical playbook, and that was authored by me and Sandy Chappelle, once again the chair of the Place Matters team. And so now I'm going to turn it over to Ayana to talk through her slides. And for some reason, it's skipping a slide. There we go.
Right. Thank you. So I wanted to bring everyone's attention just to, essentially the problem that we were trying to solve. It shouldn't be new to probably most people on this call regarding the lead poisoning situation of children here in Cleveland. Among all the children entering CMSD between 2014 and 2016, 25% had an elevated blood lead level at or above 5 mcg or deciliters at some point before kindergarten. Now, it's important also to look at this map as what was mentioned earlier regarding redlining, right? And it should probably also be no surprise that where you see the hot spots, the red areas, the high incidence of EBL are the areas that were redlined. Almost every factor, also take a step back because building and housing, what do? I manage all structures in the city of Cleveland. So I issue permits. I mean, that tends to be the glamorous part, right? But I also do the code enforcement. I also manage a multi-million-dollar demolition program every year. We raise, it depends on the year. This year, hopefully, we're going to hit 1,000 structures. So I see both ranges from development to the disinvestment and underdevelopment of communities. So every negative factor of a building and housing situation as far as code enforcement are directly correlated to the red line area. So as we look to develop, different metrics, et cetera, we don't want to heap on and exacerbate that situation, right? So we came together as a lead safe coalition of over 400 people to really try to make a mark to eliminate lead in rental properties within the next 10 years. So this was January of last year that we all pulled together. I mean, almost you name a community group, organization, private organization, foundations, et cetera, were at this table to have this conversation. I feel that it's very important it was very important, not just for the government, meaning the administration side or even council side, to try to, quote unquote, fix the problem. It had to be community buy-in. It had to be community buy-in from the very bottom to the very top. It did not matter who, for this to succeed. And with that, it took us, really, we pushed this through really fast. The coalition was formed in January of last year, and in August of 2019, a lead poisoning prevention law was passed that targeted specifically rental properties and eliminating lead in rental properties. For so long, the lead issue here in Cleveland had been really an issue that was reactive into a child tested with an elevated blood level. And just the thinking of the government for years had not really put forth a housing solution. Kim was very instrumental in pushing us towards the structure, the home, the place where children are being poisoned is the issue. And, of course, it's not just children that are poisoned. Anyone can be poisoned, but really it's a public health crisis with a housing solution. How much can we really affect children being poisoned if we look at the structure? With the transient nature of the population here in Cleveland, rental properties were targeted because, a child could live in a home, 4 different homes in just the span of a year. So we felt that targeting rental properties was very important. So now we're taking a more proactive approach. So if you look at the Lead Safe Cleveland Coalition Action Plan, it has different levels. Support, so to support us at the city to build and measure the rollout of the lead certification process. Launch a public awareness plan, so that's to help with our Lead Safe Coalition. As mentioned earlier, the government, sometimes we have a perception when people, we mail out things. Sometimes people mail it or open it. Sometimes people do pay attention to it. But when it comes from like a more neutral source, meaning the Lead Safe Coalition, we feel that there will be more receptive to that information. We have advocates as part of this big coalition to advocate on both the state and federal level for lead safe practices, policies, resources, funding, et cetera, so where no one is going at this alone. Securing investments in the Lead Safe Home Fund. We aim to raise $99 million. We're about a little bit over the $20 million mark in a little bit over a year, so we're doing a phenomenal job with that. And then launching the Lead Resource Center and home loans and grants. How do we build equity in this? How do we make sure that everyone that needs to be serviced, people that may not just understand what's going on, can just go to the Lead Resource Center, call the call center. Landlords. People think landlords, they aren't just inherently rich. Some people are mom and pop. They have 1 or 2 properties. They need resources to help them remediate the lead in their home.
So now I'm going to talk a little bit about the Resource Center because there was a national search. We wanted the administrator for the home loans and grants, and we needed an administrator for the Resource Center. So I applied, and I was selected. A lot of interviews and presentations. I was selected to manage this operations side to help landlords comply, to raise awareness in the community, to then provide workforce training, right, as well as a call center. So the Resource Center is really taking the law, creating a comprehensive strategy and a wraparound support needed for implementation. And then I have some ideas around how I would love to execute this thing, right? There's a vision. We had to think about how we would implement it. Now we're going to fine-tune that implementation process. This is new for the city. It's new for the country. I talk with National Centers for Healthy Homes often and give them updates on where we are. We also have interest from Joyce Foundation around the model that we're building. and this is a people-centered vision and approach, right? So how are we activating on the ground? What's equity in action really look like? So when we started the coalition, I was over community engagement, and so I created these leadership teams. What I also did 2 years ago, before the coalition started, was I asked specific community leaders, hand-picked community leaders, to participate in policy and advocacy classes. What we know and understand, and what I'm understanding, is a lot of folks are impacted by issues. They're angry. They know it's a problem. But I think the decision-making, who makes decisions, how, and the policy that's impacting them, a lot of folks are disconnected from that process. So we start with this foundation of policy and advocacy and how you get things done in your communities, because the people are already working in the neighborhoods, right? And then get them more information, build capacity for them to then activate and then look at policy and how they shift. And it was a great opportunity for them to participate in the coalition, participate on different committees within the coalition that were public, as well as the policy committee, because they could literally take what they were learning in real time and apply it within the coalition. So leadership teams were developed, and we built this relationship over 2 or 3 years. And so now the infrastructure is here. So the same folks that I worked with, started with, that were already in communities, already impacted parents as well, I made them the core of the resource center. And we call it a community action team. So they are the core, the resource center and the face of the resource center out in the communities across the entire city. Now we could scale up, right? So it's a one-stop shop at the resource center. And like I said, this is new, so we'll shift and change as we need to. So we this is our infrastructure in regards to our staffing and how we staff the resource center right now. Workforce is our priority right now. We have to build capacity on the ground, and also it's a neighborhood-based workforce development program that I created internally around interim controls, because we only need interim controls to implement this law. Yes.
Kim, could I, we're running a little bit short on time, so could I want to make sure that we have time for Q&A, because we've gotten some really great Q&A through the chat box, and we have just one more speaker. Can I have you kind of wrap up in a minute or so, and then if there's other information that you can share through Q&A, that would be fantastic.
Yeah, only 2 more slides. I want to run through those really quick, really one more slide. So this is just pretty much, I don't know if you can even see this, about the different teams and their responsibilities and what our aims are for the Resource Center. And then I just want to encourage you all, for more information, learn more about the coalition and the Resource Center and our activities, you can go to livesafecle.org. And I'm done. That's it for me. Thank you for listening.
Thanks, Kim. And like I said, there's a lot of questions that have been coming in, so I know that we want to engage in a robust conversation with you after our final speaker for today. So thank you to Kim and Ayanna for walking us through these initiatives. I'm really pleased to introduce our final speaker for this session. Dean Dana Bowen-Matthew will share her insights in addressing health inequities. Dean Matthew is a former board member of Change Lab and a longtime partner of ours. She served on the advisory committee for our report, The Blueprint for Changemakers. And earlier this year, which seems like a lifetime ago, in January, we co-sponsored Healing Hate, a public health perspective on civil rights in America, through the Equity Center, which she co-founded when she was at the University of Virginia. Dean Matthew has a very long and distinguished career, and she has been most recently named the Dean of the School of Law at George Washington University. And again, she's here to share her insights with us today. So please join me in welcoming Dean Matthew.
Thank you, Sarah. I want to make sure I have the technology right. Can you hear me?
Yes, you are loud and clear. Thank you.
Wonderful. I feel honored to be able to participate in this conversation, especially because this is a conversation, as is always the case, in Change Lab's orbit, among people who don't just describe the problems, but people who are solutionaries, who are actually solving the problem. I feel humbled to be added to the list, and I think I'll use my few minutes to speak just about my perspective on the kind of work that is being done. And I'm going to do that by referencing two quotes. The first is by Ta-Nehisi Coates. He wrote, as I'm certain everybody knows, that famous piece in The Atlantic called The Case for Reparations. And he said, if you sought to advantage one group of Americans and disadvantage another, you could scarcely choose a more graceful method than housing discrimination. That is the way I see it. That is the way I see the fundamental nature of the work of the people and speakers who have preceded me and who are participating in this conference. COVID-19 is simply an illustration of what Coates has said, that this country has elegantly, gracefully organized itself so that the wealth and resources and power that are needed to be healthy are distributed in ways that disadvantage people of color, women, children, and the poor. What COVID showed us, most recently I looked, and the death toll was over 217,000. The total number of cases approaching 8 million. But even more tragically, if you can imagine, the disparity by race and ethnicity. If you are an African American, you are 4.7 times more likely to be hospitalized and 2 times more likely to die. If you are a Native American, you are 5.3 times more likely to be hospitalized and 4.6 times more likely if you are a Latinx person in the United States. Is this because your race makes you more susceptible? Is this because your race makes you genetically inferior? No, it is because of structural racism anchored by housing policy in the United States. We saw that people living in New York, where the hotspot originated, were people experiencing housing inequality. They lived in densely populated houses. They lived in houses of substandard nature. They lived in houses in neighborhoods with few green spaces, with exposure to pollution. These are not by accident. A longer talk would show you that these are by legal design. So the second quote I'll close with is one by Frederick Douglass. By the laws of the country from whence I came, I was deprived myself of my own body, soul, and spirit, and I am free only because I succeeded in escaping the clutches of the man who claimed me as his property. Or in on structural inequities, on building permits. I want you to know that from the way I see it, the vantage point from which I sit, you are fighting dehumanization. You are fighting not just a civil rights battle, but a human rights battle. What do I mean? Dehumanization is the process by which a person or group of people are deemed to lack humanity and therefore to lack the need for what humans require to live. It's an age-old tradition where African Americans are concerned in this country. Certainly we can see examples of people being owned as property, as Frederick Douglass quotes describes. Selling people by weight. The pictures are horrific. Throwing them overboard if insurance was not going to be advantageous to keep them alive. Not getting them medical care. That's the history. But make no mistake about it. Our laws, our social structure, indeed our housing system, continues to perpetuate dehumanization. Why else would it be that today in 2020 people must march to drink water that does not have to come out of a bottle? Why is it that today, in 2020, we draw a map of where pollution sources, whether they're highways, landfills, power plants, are located, and we see them only near the poor, only near marginalized communities, only near Black and brown families. So I leave you with the sense that you are fighting not only for human rights, but for the humanity of us all. I said it was one more quote, but I'll have to end with one more. It's from Archbishop Desmond Tutu. All of humanity is dependent upon recognizing the humanity in others. And I want to say that you should not ever feel that the work we are doing to get housing equity for the marginalized is just and only for the marginalized. It would be enough. But to dehumanize anyone, one must dehumanize themselves. And so I would say that the humanity of our nation depends on your work. Thank you.
Thank you so much, Dean Matthew, for really, I think, pulling together the conversation today and really helping us center it's the people and the communities. It's really working towards a broader vision of the pushing against dehumanization and really centering the people, all of us, right, because we're all connected, and that we're looking the lens, using the tools and the lenses of laws and policy, community organizing and advocacy to move this work forward. I just want to say thank you to all the speakers today. Really, there's so much information, and I'm going to pass it to my colleague Greg, who is now going to run us through the question and answer series. And again, just thank you everyone for your thoughts and contributions and continuing to move this really important work forward.
Thank you, Sarah. And so I think we'll start off with my first question for Dana, which is really about how can people working at the intersection of health and housing begin having the conversations necessary to address the underlying, structural racism and discrimination embedded within the system?
So having the conversation seems to me to be the starting point. The question of how to have that conversation is to make sure, in my view, that the right people are at the table. It is not, in my experience, it is not easy to break down the silos when we speak in our own echo chambers, when housing developers speak only with housing developers, when those who work on supportive housing speak only with the people who are providing social services, when members of the resident community are not present at the table, then those conversations are siloed and those conversations are less likely to be effective. So I would say having everyone at the table is the first prerequisite. And then the second thing is patience, because these are typically messy conversations. They're going to take time, and they're going to take a commitment and an investment, in my experience, when those varied groups of actors and stakeholders get together.
Thank you, Dana. My next question is for Mark. You talked a little bit about the need for cities to develop comprehensive housing strategies. And I'm curious, what you think in your review of the strategies that are out there. What are the strategies that will be most helpful in continuing to respond to the challenges that COVID is presenting, while also, working over the longer term to really address the underlying structural racism and discrimination in the housing system?
Yeah, I'm glad you only ask easy questions here. I think a lot of what all this conversation is about needs to be taken into account here, but I'll answer it relatively narrowly. The most narrow one I would have is if you to deal with a wealth gap, there's a lot of ideas about increasing home ownership in the Black and brown communities, and there are a number of policies, but the one most directly relevant, I think, to building wealth is more down payment assistance. Is actually a transfer of some money so that people can afford to buy a home, and that is, homes are one of the major sources of wealth in this country, and that's sort of a direct one. The way you've asked it is really the comprehensive nature that I talked about before, I think helps to deal with this because, as others outlined and I did, we have a lot of problems, not just home ownership rate, but we have higher housing cost burdens, that is, housing is not affordable, lower housing quality in many of the black and brown communities, overcrowding. I'm just repeating or reiterating what other people have talked about here. And so this really requires that whole idea of a comprehensive approach to deal with the affordable housing crisis in our country. And all of those pieces that I just outlined here are part of that crisis. So you need those, again, to repeat a little bit here, reiterate the four pillars. We need more housing in many communities. We need more government to subsidize more affordable housing. And we need to make sure that people in all communities have access to good quality housing and make sure they're able to stay in their homes. So this is, again, the basic point of comprehensive is it's not one policy. There's no, as I'm sure most people realize on this webinar, there's no magic bullet here, but it requires a whole array of policies to make the housing market and housing accessibility more fairly distributed.
Thanks, Mark. And I appreciate your calling out to the comprehensive approach that's necessary to really dismantle all the different aspects and the different ways that racism has impacted our health and housing. The next question is going to be first for Kim and Ayanna, and then I would open it up to the rest of the panelists as well. But how has COVID impacted your work and the environmental health work that you all have been pursuing over the last year? And how do you balance the issue of trying to pursue improvements in housing quality versus the argument that in doing so you might actually be displacing or creating new limits on access to housing for people that need it?
I'll go first, and then Ayanna can chime in. I guess built into the law is this evaluation component, and we were very intentional about understanding the impact that it could have. We know we feel it's a good thing, but there could be negative impact. Therefore, we want to evaluate that, and we'll stop what we're doing and make sure we make some shifts. I did include the resident leaders who are on the ground in community building, out, the face of the resource center, and could actually serve as an evaluation component as well, because they'll be talking to tenants, landlords, and residents real time, sharing that information, and then we'll take that into the steering committee, to the coalition, and the folks that help make decisions. So I think there's a way that we're trying to implement this so that we do get real-time data, understand what's going on the ground. As far as the impact of COVID, with this particular work, we moved our offices, we built the infrastructure, we hired folks. The team is out now for Lead Poison Prevention Week. We make adjustments. We are hosting smaller workforce development trainings. We have 8 to 10 people. We have a large space so that we can social distance. So we're still moving forward with our work.
And for us, it's been real interesting because one piece that I did not mention is that our department, about 2.5 years ago, we started a proactive rental inspection, meaning systematically inspecting the interior and exterior of rental units. A lot of details, but nevertheless, because of COVID, we stopped, right? We stopped all interior inspections starting in March. We have restarted some interior inspections in August, but of course now, because of the surge, et cetera, we are reevaluating how we will proceed with inspections. And it's very disheartening because there are so many more factors that are baked into this. You do have, of course, an eviction moratorium. However, how does that really translate to a tenant that does not really understand how that applies to them? When you have landlords that are self-helping and evicting people and just putting people's belongings out on the curb, there's really not time for a tenant to say, oh, no, there's an eviction moratorium. They're just finding another place to live. So it has also created us a different lens of how we handle complaints, how we handle these situations for tenants just, throughout COVID, and how we handle continuing our process of making sure that rental units here in Cleveland are somewhere where someone should actually be living, that's actually healthy, a housing situation. And also for displacing tenants, to circle back to that and what Kim said, our lead legislation baked in 3 boards/commissions. The 2 that are relevant here, the Lead Safe Advisory Board, that also has a lead safe auditor who's a third-party neutral entity that evaluates any unintended consequences, particularly for the lead legislation. So as far as displacing, one common thing that landlords have said is that this will increase rents and increase the amount of money that they have to spend on rental units, which is very important. Where on the one side of Cleveland, the east side of Cleveland, average home price here in Cleveland is $27,000. That doesn't exclude rental units either. This is for every unit, right? So it's important to think about those things. But also we have a housing, more or less like a housing action board. So organizations that receive funding from the city of Cleveland, housing organizations will sit on this board and come up with a list of units. So in the event that tenants are displaced for a variety of different reasons, that they will have a place that is semi-permanent, could be temporary for a week, could be what have you, that will allow people to have somewhere to live. So, quick answer.
Thanks. Did any of the other panelists want to respond to that? All right, hearing no takers. Another question that we got in, a number of them have been surrounding the upcoming expiration of the CDC eviction moratorium. And so I think there's a question, I'll pose this to the whole panel, about what are the most immediate things that advocates and city employees should be working on right now to deal with that, impending cessation of the moratorium? What are the things that need to be in place to make sure that we're not going to experience a windfall of negative health impacts afterwards?
Well, I'll join in here. The first answer is try and get it extended. I think that is a good idea here. And there are lots of defects with the CDC moratorium, but it has been helpful, and either get it extended to the national level or states are able to do that. And a number of governors have done it, a number of legislatures have passed legislation to extend it. The second and the most important, and I know there's efforts at the national level because we need lots of this is very costly, is rental and assistance, and that's assuming that we don't get at the national level extension of the supplements to unemployment insurance. That turned out to be, or appears to be, and I think research will show that it turned out to be extremely helpful to most people who had a job before and lost that job, and that if you can restore a decent amount of income to those folks, as we saw the first few months here, people were able to pay their rent, and so that helped, honestly, helped the whole economy. So, it's back to what I said before a little bit about federal. We need more federal assistance, but people may feel that's very remote. So, in terms of lobbying or whatever, states don't have a lot of more money either because they're under some of the same constraints as localities, but there is some money for rental assistance, and at the local level, that would be important to try and make sure that that's funded as best they can.
And I'm curious, Ayanna, not to put you on the spot, but I'm wondering, as a city employee, if, what the city is thinking about in terms of some of these looming deadlines.
Well, it's interesting, right? Because quite frankly, I think that more focus, at least for us here, I agree that it should be extended. Now, this is also my personal opinion, and I do not attribute it to the whole administration of the city of Cleveland, but that it should be extended. But as I kind of touched on a little bit earlier, I believe that still the communication between the community that needs the help and actually knowing the parameters and just, whoever, the CDC saying that, well, these are the rules. So locally, we've been doing a lot of different forums to inform the community, like, here, this is the affidavit, this is what you have to produce, and this is how it works. But I think that there is still a breakdown in communication to even make this as effective as it should be. So even just an extension would be great, but there needs to be just more of a massive communication effort and outreach to let people know. Our housing court here has been doing forums. I mean, it's been everyone, but still, we have a legal aid society. We have right to counsel here for people that are being evicted. I'm not sure if people know about that. There's a lot of things going on in Cleveland, but still a lot sometimes still isn't enough. So.
Thank you, Ayanna. This next question I'd like to maybe pose to Dean Matthew, but you can open up to the rest of the panel as well. I think we've been very intentional, and I think a lot of us have been intentional in our conversation here not to try to include microaggressions in the language that we're utilizing. But I think there's a criticism that has been levied against advocates and people working on these issues where we're focused overly on gaps and problems and things that might be projected identities onto communities. Now, I'm just wondering, if you all have thoughts about the best way to approach this work where we're both, talking about addressing real challenges, but doing so in a way that isn't, stigmatizing the communities that we're trying to work with. And, maybe for Kim and Ayanna, what does that mean in terms of the work that you all have been doing in Cleveland?
Well, I'll start, but I think we quickly have to go to the other two speakers who are actually doing the work. One of the things that I believe is that we should distinguish race from racism. We should distinguish structural inequality and structural racism from the problems that we see distributed by race, right? So if we're talking about housing problems in neighborhoods that are predominantly Black and brown or neighborhoods that are predominantly poor, what we need to be making sure that we do not do is ascribe these housing problems to the people because of their racial, ethnic, or economic status. It is because of the structures that located them there. Likewise, when we do our solutions, I don't think they should be regarded as solutions that are charitable to help that group that is disadvantaged or charitable to help the other group that is disadvantaged. And we get into this sometimes when we talk about segregation, which is, in my view, a fundamental cause of health disparities, right? But the answer to segregation is not necessarily desegregation. It's not because I want to live in neighborhoods that are not Black and brown. It's not because I don't want to live where my neighbor. I don't want to live in neighborhoods that are structurally unequal. I don't want to live in neighborhoods that are structurally defective. I don't want to live in neighborhoods that have a disproportionate share of the pollution and the violations of building permits. I think we have to think about these not as racial problems, but as racism problems. That's one thing.
Hi. So maybe I'll turn it over to, go ahead.
Oh, thank you. I'm sorry. So this is Kim, and this is very important to me just because what happens is we sit around a table and create these narratives or keep generating these same old narratives instead of asking a question of folks who are having a lived experience. I've been at tables and people are starting to come up with all of these solutions. I said, let's stop right here. Let's go to the community and talk with community as partners, right, and support the solutions that they create. I've done this model. I still build projects, programs off of an action plan that residents generated, created. They understand data. They can take it, they can analyze it, and then come up with solutions. So this is one piece of process, also connecting policy to engagement strategies. Oftentimes, we go into communities, create a program, have a community meeting, act like that's the end-all, be-all, and think we've done something versus we got to continue to go back and build relationship and partner. And then another thing I just did it last year in a community of color, that the narrative was that the community is dangerous, nobody should go down there after dark, and the whole host of things. But I had a festival with 6,000 people from all over the state attend in a community. A national artist came, and we had the best time. People are still talking about that. Culture and arts, it was a national project I did as well. And there's a radio station in the community, and to let the residents speak for themselves. We have to stop speaking for people, about people, and really ask the question and partner.
Just for 2 seconds, I apologize because I'm not going to credit the right person. I was at a conference a couple years ago, and something really stuck to me and really related to this. We like to use the word empower, right? As if residents and people in their community, pick a community, doesn't matter, right? When you say there's attention to this community, we're going to go in and we're going to empower these residents to do X, Y, and Z. Then that insinuates that people don't already have the power. They do. They just may not know how to get from point A to point Z and fill in the blanks in between. It's not as if somebody is coming in to do something special and give people power. Residents know what they want. They have to be at the table. They know what works. They know what doesn't work. They've been a part of that, whatever community picks a community for years upon years. They know. So it is imperative that the community is at the table when you're formulating whatever. If you don't have community buy-in, chances are it's not going to work, no matter what problem you're trying to fix.
Great. So I think with that, we're actually running just a little over time, and so I'm going to have to end the facilitated Q&A right now. I do just want to express another round of thanks to all of our speakers for really joining in this conversation. I think, it's really a very important conversation right now. I know that there's lots of different aspects of it, all the way from the nitty-gritty of what are the housing solutions to how do we talk about race, but I actually think this has been a really great conversation that shows the connection between everything and I think really reveals all of the different layers of how structural racism is embedded in our housing system and how we need to be able to talk about it as government employees, as advocates, as citizens in our conversations. It really does need to be a point of conversation so that we can really explicitly and directly address the challenges that we're facing and be intentional and purposeful in how we're trying to remedy them. So with that, I would just love to encourage everyone to keep this conversation going. I'd be happy for you all to reach out to me at my email address on the screen. And we are continuing this series a little bit for some further conversations. And if you have questions about that, please feel free to reach out to my colleague, Tina Yuen. And with that, I just want to express a round of thanks again to everyone, and to encourage you all to utilize this conversation and keep this conversation and start this conversation with new colleagues and in your personal lives. So thank you.